To the Pioneer. My name is Mandy Granado, and I'm a contributor of the Pioneer. Today, we will be talking about the Bay Area fentanyl crisis. We'll be hearing from two experts on this subject who will give their insights and experiences on this crisis that is ravaging the Bay Area.
I am Gabrielle Pushpoki. I am an EMT for NorCal Ambulance. I mostly do interfacility transport, but I'm also trained for emergency medicine and 911.
I'm Lou Pushpokey. I'm an RN, 34 years. Most of that time in the emergency room, certainly most of that time in critical care.
And you're currently in
I, I, I work in the Bay Area in the emergency room in San Leandro.
So, first off, can you describe the prevalence of fentanyl-related incidents you've encountered in the Bay Area and how it could compare to previous years?
See somebody with a fentanyl overdose every other day, every third day, and then some days maybe you'll see several cases of it on the same day. I think that's a lot every shift. 14 years ago, you didn't see any fentanyl overdoses. So that's a big increase.
Yeah.
Yeah. What are some common misconceptions that people could perceive about fentanyl and its impact on individuals and communities?
Most of the time, I think people don't know that they've taken it. I have had a few cases where people did know. Uh, it's amazing that people do it and then they come back again and for the same thing, same problem. You'd think they would make some kind of change. It's terrible when you see somebody overdose and like that, and you see the impact it has on their families. It has a lot of impact on the healthcare community. Um, especially right now after COVID. I mean, the healthcare community's been through the war, and then we're still fighting these same battles.
The misconception of giving fentanyl in the hospital versus street drugs. So, like, for example, fentanyl is one of the most common drugs that we give pregnant ladies right before delivering in their epidural. And some pregnant ladies have been like, whoa, you're giving me fentanyl. Like, they hear about it in the news and they think it's really dangerous and bad. But in the hospital, it's much more regulated. I mean, the reason we give them fentanyl is because it has a shorter half-life, so it doesn't get in the breast milk as much as other pain medications too. So I think the misconception I would say is that, like, if we're giving it to you in the hospital, it's under a controlled environment and we know exactly what's in it. And when people are taking it recreationally, it's a lot more dangerous out in the field.
It's a great drug, short acting, gives you really good pain relief. We give it in like micrograms. I know they're not putting in micrograms in the street drugs.
In what ways have you observed fentanyl impacting different demographics within community, like age groups, socioeconomic backgrounds, different cultures, things like that?
I think it's certainly affecting the poorer community worse. I'm sure there's a lot of socioeconomic reasons for that, but it's definitely not evenly distributed. And then you'll still see a rich kid who's buying from the wrong dealer.
Yes, it's probably more prevalent in younger people, but like you can get 80-year-olds who have taken fentanyl. Like it's every age group.
Yeah, I see it all across the spectrum, basically because, there's drug users of all ages. One of the more recent people I remember, there was a 50-year-old lady that had fentanyl overdosed,
Mhm.
and she was not doing real well with it. But we had seen her previously many times, and then I don't think, in the ER, we kind of save them for the moment and they move on. I'm not so sure she survived after she moved on. She was in a bad way.
What are the resources that people who overdose get while they're in the hospital? I know you can't force anybody to like go to rehab or anything, but is there a procedure that you guys have to go through when an overdose comes in to give them resources, or how does that work?
We offer them help. We can't mandate anybody go into any programs or anything. We certainly try to connect that. You'd be surprised how many people totally rebuke it, or 2% are like, yeah, maybe I'll listen to that. And then usually that's like even a half-hearted gesture. Like it just does not seem like a lot of people reaching out for help, at least not where I work, when they're at that emergency point. Now, maybe when they're having a family intervention or something, maybe that's more successful. But when people overdose and stuff, they just kind of, when they get better, they just want to get out of Dodge. I
What's
don't,
gonna convince these people? Just seeing other bad outcomes of like, hey, look, these other people went down this path and it didn't work out for them. So
I don't know. It's hard to understand.
yeah.
Challenges do you face as an EMT, possibly when responding to fentanyl-related incidents, and how do you navigate these challenges effectively?
A lot of them have schizophrenic issues and other mental health issues, and health insurance issues and homelessness issues. So they're sometimes really hard to follow up care with them, like you were just saying as well. Making sure that after one incident happens, more incidents don't continue to happen.
You're seeing it
Things
cut.
like
You're
that.
seeing fentanyl cut into so many drugs. They'll put it in meth. You know, I can't think of something that it's not in. And the problem is some things make it more potent. Like if you use alcohol with it or cocaine with it, it just makes it more potent. Fentanyl itself, like I say, it's a very safe drug. We give it all the time when it's a drug, but when it's a
Not-
recreational drug, that's a whole different ball game.
Mhm.
And then that's compounded again when people think they're taking one drug and they're like they always take whatever their amount is of that drug, and then they get one laced with fentanyl, which is 100 times more potent than what they're used to getting. It's a bad outcome.
Do you think the availability and accessibility of Narcan could help with this crisis?
You can go to the emergency room, anybody in California, and ask for some Narcan. We'll give it to you. We just want it flooded out there in the community, get it out there. And then we don't ask for your name, we don't ask for anything. You just show up, say I'd like to pick up some Narcan. We say, here you go.
Thank you guys so much. That was great. I really appreciate you guys. And a big thanks to all you guys watching today. My name is Manny Granado with The Pioneer, and I'm signing off.